Hi, I'm Dr. Shazam Hussain. I'm the director of the Cerebrovascular Center at the Cleveland Clinic. I've been working with patients with fibromuscular dysplasia for a number of years. My main role clinically is I take care of stroke patients as well as do interventional procedures for the blood vessels leading up to the brain. This could involve things like dissections or cerebral aneurysms. Fibromuscular dysplasia is a very interesting condition. Was very much underappreciated in the past, and certainly we're getting more and more knowledge about fibromuscular dysplasia. In my particular role, I get to see it in relationship to those conditions like dissections in the carotid or vertebral arteries, as well as with brain aneurysms. Certainly when FMD is present with those conditions, it's important to recognize the impact that FMD can have with the underlying fragility of the blood vessels and how that can impact the different types of treatments. Overall, we generally speaking try to treat this condition conservatively. As for body dissections, the body actually has a lot of capacity to heal, and it will often heal a dissection of the carotid or vertebral artery without requiring any particular intervention, as long as we have some blood thinners to try to prevent any stroke-related complications. If it does require treatment, though, the good news is that there are very, very flexible new technologies in terms of catheters and stents, which allow us to very safely and effectively treat these conditions. With regards to brain aneurysms have been found now to be quite prevalent within patients with fibromuscular dysplasia, being seen in up to 17% of patients. For that reason, we recommend getting an MRA scan of the brain done every 2 years to screen for the development of brain aneurysms. The good news there as well is that the majority of times these can just be observed and don't require any specific treatment. But if they do get over a certain size, usually about 4 millimeters, we'll start to have conversations about the possibility of treatment. Again, in this situation, the device technology has come a long way with very flexible catheters and devices that can be used to treat brain aneurysms in a minimally invasive fashion, allowing very, very good outcomes. We do also want to make sure that we also recommend to people to know stroke signs and symptoms, and we use an acronym called BFAST. B standing for balance, if there's any difficulty with a person's balance. E standing for eyes, if they have trouble with their vision, loss of vision or double vision. F standing for face, droopiness on one side of the face or the other. A standing for arm, paralysis of an arm or even a leg. S standing for speech, difficulty speaking or getting your words out, slurring of the speech. And that T is in there as time to call 911. Very, very important in the situation of a stroke symptoms that you get to medical attention right away, because there are very effective treatments, but they are very time limited. So important to seek that medical attention right away. With regards to the future, I think it's great to see all the research that is being done in the area to understand fibromuscular dysplasia. Of particular interest right now is the issue of carotid webs, which are little pieces of tissue that can exist in the carotid arteries in situations of fibromuscular dysplasia, and how to best understand and treat that condition. So this, amongst many other work that's being done to understand fibromuscular dysplasia and its impact on the body, as well as the genetic basis, I think there's an exciting future ahead. And congratulations to the FMD Society for their 20th year anniversary. Thanks.